Today, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director for Greenfield Health Department, Claire Woodall-Vog, the Executive Director for the Milwaukee Election Commission, George Christensen, County Clerk for the Milwaukee County Election Commission, and Julietta Henry, Elections Director for the Milwaukee County Election Commission. Thank you all for being here. It's a full agenda. So with that, we will start with Mayor Barrett.
Thank you very much, Catherine. Good afternoon, everybody. I want to talk first about testing, where we are with testing. As of yesterday, August 5th, our National Guard testing numbers are as follows. At UMOS on the south side, we saw 1,153 people. At Custer on the north side, we saw 537 people. So the total for Milwaukee this week has been over 5,400. Just to put this in context, I was talking to someone yesterday who was in touch with some people in Colorado.
I don't mean to interrupt, but if you're able to turn on your camera, we can't see you right now.
Sorry, let me get that. Hang on one second. Give me a second. I'm not trying to hide from you. Give me a second. Oh, here we go. Start my video. Great. Is that better?
It is. There you
All
are.
right.
Thank you.
All right. Sorry about that. And as I was saying, I was talking to someone who was talking to a friend of theirs in Florida about their testing and how proud they were that they had testing of 300 people at their site for the week. And this was a gentleman associated with UMOS. And he said he didn't have the heart to tell them that at UMOS in one day they tested 1,100 people. So you can see that the help of the National Guard has been really, really critical here. The fact that you can do 1,100 people there, that you can do 500 people at Custer. We're getting a lot of testing that's done, which is a great segue to talk about our key indicators for this week. Testing is one of the two areas where we're green because we've had such a huge amount of tests that are going on out there. And there are some challenges that are occurring right now at some Aurora sites because of their inability to get the reactive that they need. But having talked to them this morning, it's their hope that they're going to get that as quickly as they can. They're going to keep their Sinai site open. And the question I had is this a temporary pause or is this a change in policy? And I was told this is simply a temporary pause until they get the reactive agents that they need. So that's something, and maybe Dr. Weston might want to talk a little bit about that, or Darren might want to talk a little bit about that. But again, the good news today is that the testing for the past week has been in the green area, which is the best area. Care, which has also been in the green area. And this goes to our hospital beds, the number of people in intensive care. And again, when you look around the country, when you look in the southern states, for example, and you see these intensive care units that are really overflowing, when you see the lack of hospital beds, we have been able to maintain what we need here. And that's important. We still have the site at State Fair Park. And as I've said countless times, I'll be the happiest guy in the world if we never have to use it. But it's an insurance policy that's there. And I think it's been a good investment, and it's well worth the investment to have that insurance policy. The three areas where we are now in the yellow area that mean that we have to continue to monitor are the number of cases. We want to see that continue to drop. We have seen some progress there, and again, Dr. Weston or Darren can talk about that. The PPE remains a concern. We want to make sure that we have enough protective equipment. And then the contact tracing. We were able, at least in the city, to be able to get some librarians to help us. We had some nursing students helping us. The librarians, many of them have gone back to the library, which is good news, but our health department is working to replace them now. So we are still in the yellow area on tracing. In terms of the positivity rate that we're seeing an average of 7.7% positive cases, which is a decrease from the 9.2% positive last week. And when we say a decrease, a lot of times people consider that a negative. It is a very good news that we are seeing our positivity rate drop from 9.2% to 7.7%. That's the direction we want to go. We want to have decreases in the positivity rate. And I realize that's sort of talking in negatives. A negative, we want to see an increase in the negatives, but that's absolutely what I want to see. And this is the first time we've dipped under 9% since June. So that's, again, a big positive as well. We're, again, doing a lot of testing. We're averaging 2,100 tests per day, which is currently above our benchmark of 2,000 tests per day. But it's continuing to decline from where it's been. And I think we may have a challenge with the Aurora sites. And so that's something we're going to be monitoring very, very closely. In addition, our contact tracing is at 79.9% of COVID plus residents successfully reached within 3 contact attempts. This is an increase, so this is an improvement from last week, and it's the highest we've seen since early July. We want that to go even higher. We want to get to the green category for that. I think many people are aware that next Tuesday we have our primary election, and as I mentioned on our call Tuesday, we have seen a 1,000% increase in the number of people who have requested absentee ballots as compared to what we saw in the August primary before the presidential 4 years ago. And I want to say thank you to Claire Whittle-Bogg, the executive director of our election commission, as well as her staff and the team of poll workers who are dedicated to making this election happen in the safest way possible. They're doing a lot of work. There was an issue today, I think, and Claire will probably touch on this, with Manitoba School, and I think a change in site. I'll let her talk about that. But we're glad Claire will join us on this call to briefly share some important details about the upcoming election, and you'll be hearing from her shortly. So with that, I'd like to turn it over to County Executive Crowley and thank him for all the work that he's doing as well. County Executive?
Thank you so much, Mayor Barrett, and thank you for your leadership as well. And as the mayor said, we're doing everything to make sure that we have a safe election. I also would like to say thank you not only to the City of Milwaukee's Election Commission, but Milwaukee counties and everybody across Milwaukee County for what they're doing. Because the upcoming elections are critical, and voting is a fundamental human right that we all must exercise at all times. Your vote has the power to create that change, and we've heard the nation's cry for change. And by voting, you have a voice in choosing leaders that will push for policy change and fight for racial equity. So whether you apply for an absentee ballot or if you're going to vote in person, please make sure to show up on August 11th. Your vote does make a difference. And it's great to have our city and county election commission representatives on today's call to talk about what precautions we're taking to make sure that we're not only keeping our poll workers safe, but also all of our residents. So if you are voting in person, please remember the 3 W's, which is watch your distance, wash your hands, and please wear a mask. I also want to briefly touch on, not too long ago, we made an announcement. I had the opportunity to join the Milwaukee County Parks team to announce the Love Your Parks initiative, the next steps for that. And today's announcement really focused on the unique partnership that Milwaukee County Parks have with Stone Creek Coffee. We're thankful to Stone Creek Coffee for stepping up to create a special Love Your Parks roast that will be available at all of their stores in the greater Milwaukee area, but as well as online. And parks are crucial to our physical and mental and emotional well-being of our community, now more than ever, but I think you all understand that. But when we think about our parks, we're at a crossroads, and the funding mechanisms to sustain our parks is currently broken. This time of a global pandemic, it has really magnified and accelerated the reality that the fiscal model that currently funds our park system for years is failing, and a new and long-term funding solution is needed. The story here is not new, but the reality is growing starker every day. Funding for our Milwaukee County parks is unsustainable. We know the community perceives the parks as essential, but that perception does not reflect our financial reality. Unfortunately, there's no legal requirement to fund our parks, and the state doesn't recognize the parks as a mandatory service. And our park resources have been in jeopardy for some time now. Deferred maintenance has been long have been an issue, and the impacts of COVID-19 are adding to the extreme challenges of our non-mandated revenue-dependent park systems, threatening its viability. That's why I continue to emphasize the need for direct and flexible funding from both our state and federal legislators. These funding deficits are not sustainable, and we must do everything that we can to save our natural resource, because it's beautiful, and continue to make them accessible to everybody in our community. And so if you want to come visit one of our beautiful parks this Saturday, on next Saturday, August 15th, the We Care Crew Coalition is hosting another bike drive at Brown Deer Park from 9 a.m. to 5 p.m. And if you're interested in the details, you can visit wecarecrewmke.com. I also want to let folks know again that I want to invite folks to tune in on next Monday, August 10th from noon to 1 as I give my first vision address. We're going to be talking about one county stronger together. And during this time, I'm going to lay out my Milwaukee County vision and how we're working towards becoming the healthiest county in Wisconsin by achieving racial equity. And again, due to the COVID-19, we aren't hosting anything in person. So you can find us online, live stream it on YouTube. You can also visit the Milwaukee County website, county executive website, for more information. And as we get that, we'll make sure to get that out to everybody. I just want to say thank you again for joining us, and I'll hand it over to Dr. Weston.
All right. Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have 20,521 cases of COVID-19 in our community and 389 individuals who have died. When we look at our county dashboard, we are seeing some potentially hopeful trends. We see a downtrend of cases, though that is coupled with a downtrend in the volume of individuals getting tested. However, we're also seeing a stability at percent positivity, right around 8%. We're hopeful that we can continue to drive that number down. And we see stable to even declining levels of hospitalizations in the county. Now, if we've learned anything from the first few months of this pandemic, it's that we'll see good trends and we'll see worsening trends at different times as we go on. But these promising trends at this moment speak to the importance of perseverance in testing, in physical distancing, and in masking. While it's too soon to see the effects of the statewide mask ordinance put in place about a week ago, we're 3 weeks out from the City of Milwaukee's mask order, and maybe seeing positive outcomes from that critical step. Without clear national guidelines and national policies on issues such as testing, physical distancing, and masking, we've seen significant diversity among the different states and the different regions of our country. While we see uncontrolled spread and high positivity in many areas in the south of the United States, we're witnessing very low positivity levels in the northeastern states, and in the Midwest, a concerning gradual rise in positivity. We in Wisconsin, and specifically here in Milwaukee County, have the opportunity to continue the promising trends that I discussed earlier and to further push down our positivity rates. By following the statewide mask orders, by continuing physical distancing, and by being aware of our surroundings and cautious in our activities, and by seeking out testing when we're symptomatic or we have concern for COVID-19 infection, we can set ourselves apart from other parts of the country and move in the right direction. The mayor talked about the change in testing sites. So despite these fluctuations in testing sites, we still have 6 community health center sites. We have 11 health system sites, 2 National Guard sites, and 6 pharmacy-based sites that can be found on the Impact 211 website or accessed by calling 211. We've talked about the sacrifices inherent in this pandemic. We're all making some sacrifices, and many of us know individuals and families that are making much more severe sacrifices. But through each of our small sacrifices, these small changes in our lifestyles, we seem to be making progress. As I said, we'll have ups and downs to be sure, especially with the school year starting, with the fall approaching and flu season behind that. But if we continue to be vigilant, we can give ourselves and our community the best chance to decrease the burden of disease and minimize the number of people who have to make those severe sacrifices. Thank you very much, and stay safe, and I will hand it to Director Roush.
Thank you very much, Dr. Weston, and I hope everyone's having a great afternoon. It's my pleasure to give the weekly epidemiology report and taking a closer look at the data that Dr. Weston just so eloquently summarized for us, and we'll see that in a graphical representation here as well. I start today with the daily number of COVID-19 cases. Again, for orientation, the orange bars are City of Milwaukee's daily number of COVID cases. The blue bars are the suburban communities' daily COVID cases. And the orange line is a 7-day trend for Milwaukee, and the blue line is a 7-day trend for the suburban communities. And as we've talked about for a number of weeks, we've seen an increase, or we had seen an increase in early July through mid-July, a little bit of a plateauing in the suburban communities and a slight decrease in both the suburbs and the city. I always note that we do have a little bit of lagging data over the last couple days, so it looks like this trend is down. But what's concerning to us in the suburban communities is our rates continue to be, for COVID-19, continue to be higher than they have been throughout the outbreak. So while we were higher a few weeks ago, we still remain higher, and that's certainly concerning for us as we head closer into school and other fall activities that may be starting soon. So cases are down slightly. Deaths had been down for a long period of time, but I will point out that deaths have been remaining pretty flat over the last several weeks in both the Milwaukee County suburbs as well as the city of Milwaukee. And more recently, it looks like the rate, the 7-day rate in the suburbs is actually a little higher than the city. So again, something that we want to watch carefully going forward. We've seen a lot of growth rate. One of the things we've looked at a lot is the reproductive number. And here for Milwaukee County as a whole, we see that the number for the transmission rate is below 1. That's very helpful because that means we're suppressing the outbreak. When we look at the city of Milwaukee compared to the suburban communities, we see similar trends, but we see a more pronounced decrease in the city of Milwaukee than we do in the suburban communities. So right now, both are below 1, but the suburbs are certainly inching up closer to 1 than the city is. And remember, we want to keep that transmission rate low because that's indicative of how many cases are occurring because one individual became symptomatic and laboratory confirmed with COVID. We continue to track all of our demographic characteristics, and the trends are still the same as we've seen in the past. The 18 to 39-year-old population is growing at the highest rate, not only in terms of absolute numbers, but in terms of their rate. We continue to see cases in the Hispanic community leading the way in Milwaukee County, but we've certainly seen a pretty sharp increase in the white community starting in the early part of July. So right now, the Hispanic, the African American, and the white populations, total cases are starting to come together. The Hispanic rate is still 2 times higher than the other racial and ethnic minorities in Milwaukee County. So we continue to watch that very carefully. As Dr. Weston mentioned, testing has been down, and I can certainly show you that here on this graph. From a peak testing about a month ago in week 17, where we had nearly 30,000 tests done in Milwaukee County, we have been decreasing over the last 3 weeks. Percent positivity has been slightly inching down a little bit, but we're still hovering around 8%, as has been mentioned. So we need to be very vigilant and make people aware that testing is available and testing is readily accessible if you want to seek it out, and certainly calling 211 is the best way to find a testing location near you. The 14-day trend, as we see it down here in the bottom right, has not changed for Milwaukee County in terms of percent positivity, so that's something we want to continue to watch. Lastly, I'll talk about our spatial maps of where COVID has been occurring. The first map here shows all of Milwaukee County from the beginning of March through the first part of August, and this particular map shows the last week. So we're looking at a time period here of July 29th through August 4th. Again, we see a similar pattern to what we saw last week. North of 94 doesn't seem to have as much disease activity as south of 94, and we see very large areas that are red in terms of high incidence of COVID throughout the southern suburbs, throughout the south side of Milwaukee, and those areas are areas that need additional education, outreach, and testing to really combat COVID. When we look at a map of testing rates, we do see that there's a wide variety of testing available in many locations, but there are a couple areas, these might be more rural areas that haven't been tested as a higher rate, but please know, folks in the community, testing is available, and all you have to do is pick up the phone and call 211. So just in conclusion today, I just want to highlight, we're continuing to see high rates of COVID disease, especially in the suburban communities, and that COVID disease in the suburban communities still remains high, still remains higher than the months of April, May, and June. So that's something we need to continue to watch. We're still seeing deaths, although they're happening at a lower rate, which is promising. The data today is promising. The data today indicates that we're moving in the right direction, but we can't take our foot off the gas pedal yet. The continued rates of COVID-19 disease really impacts businesses, schools, and other businesses on what happens in the coming weeks. Public health is working closely to make sure that we can investigate and contact trace all of these individuals, but we need your help in the community when we go through that process. Answer the phone, tell us the information we need so that we can do our jobs and appropriately work to mitigate COVID. As I've mentioned in the past several weeks, personal decisions and personal choices that are being made as a collective of society are impacting COVID-19 disease rates. We're 3 weeks out from a city of Milwaukee mask ordinance. We're almost a week into the statewide mask ordinance, and I'd like to believe that's going to start making a bigger difference as we go forward. It's just too early to tell right now. But as we've discussed previously, continue to follow the 3 W's: wearing a mask, watching your distance, and washing your hands. And remember, the trends are looking promising now, but we must remain vigilant. Thank you for your time, and I'll turn it back to Catherine.
Thank you, Director Rausch. Now we'll hear from Claire Woodall-Vaugh, who's the Executive Director with the Milwaukee Election Commission. Thank you for joining us today, Claire.
Thank you, Catherine. I wanted to update everyone on our plans for next Tuesday's August 11th partisan primary. The city of Milwaukee will have 168 polling locations open, which is a big change from April 7th. We have had some polling place changes. Approximately 12 sites have been relocated due to unavailability. All of those voters should have received a postcard in the mail last week letting them know of the change. However, I always encourage voters to go online to myvote.wi.gov in order to confirm their registration status and check their polling place before Election Day. That website does have all of the up-to-date polling places. And then just really wanted to prepare City of Milwaukee voters on what they can expect next Tuesday. So it will be your neighborhood voting experience. Your polling place will look familiar, hopefully, and be set up a little bit differently than normal. But you should expect to see plexiglass barriers between yourself and election workers. All of our election workers will be wearing face masks and face shields. Some might be wearing gloves, but we'll also have hand sanitizer available at every step of the way along your polling place and your voting experience. And then we also will have staff dedicated to disinfecting surfaces like the voting booths. Our voting booths will be spread out 6 feet apart. And then, you know, hopefully if you are comfortable going to your local grocery store, you'll feel just as comfortable going to vote on Election Day. We have received an overwhelming amount of community response and support this summer and have trained over 700 new election inspectors who we look forward to welcoming onto our elections team next Tuesday. So when you go to your polling place, you shouldn't expect long lines, but you should be patient with your poll workers because a lot of them will be new. And then I wanted to give up an update about absentee ballots. We have sent out over 75,000 absentee ballots by mail and have received close to 30,000 absentee ballots back for this election. Normally in a partisan primary, we would send about 7,500 absentee ballots out. So the demand is definitely still out there. If you have received your absentee ballot, but you haven't returned it to us yet, I'd encourage all voters to use a drop box or to use an in-person absentee voting location. At this point, it's a little risky to stick it back in the mail. We have to receive all ballots back by next Tuesday. Yeah, and I will pass it over to George Christensen with the County Clerk's Office.
All right, thank you, Claire. I appreciate it. Good afternoon. George Christensen, Milwaukee County Clerk. I also serve as Executive Director of the Milwaukee County Election Commission. First of all, I just want to say that it's been a real joy and pleasure working with County Executive Crowley and Claire Woodall. There have been some changes, of course, with County Executive Crowley being elected, and there's been just a seamless transition, just no drop off. It's been absolutely amazing, and I'd like to echo that for Claire. It's just done an incredible job, and it's just been a joy to work with both, and we've been extremely lucky. So thank you both. As Claire mentioned, of course, election is Tuesday, August 11th. Polls open at 7 a.m. And they close at 8 p.m. Things that you need to know before you go and to vote safely include, well, today at 5 p.m. is the last day to request your absentee ballot if you haven't already done so. As Claire mentioned, myvote.wi.gov is the location. Friday is the last day to vote, to early vote in all municipalities in Milwaukee County, with the exception of the City of Milwaukee. So for that information, again, go to the City of Milwaukee's Election Commission website. But the rest of municipalities, if you intend to early vote, please go and do that today or tomorrow. For example, myself, I live in the city of Greenfield. My plans after this meeting are to go over to my city hall and to request my ballot, to mark my ballot and give it right back. Of course, wearing a face mask and socially distancing. So we want to just make sure that every vote counts. So make sure if you do vote absentee that you sign and have your ballot properly witnessed. Witnesses are required to sign the envelope and provide the address. And if either one of those are missing, your ballot won't be counted. So it cannot be counted. So please make sure you follow the instructions carefully. With respect to safety, we have been working closely with the state of Wisconsin and all municipalities within Milwaukee County to ensure that this election is as safe as we can make it be. For example, we've distributed well over 100,000 PPE, personal protection equipment items to each municipality, not each, but in total, to make sure that they have the supplies they need. So therefore, poll workers as well as voters are safe. So again, we ask the voters to also please follow the instructions as you get there. Wear your masks, follow social distancing practices. Of course, we've received notification from Governor Evers that the National Guard is available for use on Election Day. We have coordinated that once again with the 19 municipalities, and we'll continue to work with them to hopefully utilize those resources in the best way possible. Once again, on election night, Milwaukee County will receive the results from each municipality, and we will be not only having a space for them, for the press and public to view it. That will be there. However, we would encourage you not to come, and we would encourage you to follow it on a live stream. And we will be live streaming that again via our Facebook page. So please be on the lookout for that. With that, I will now turn things over to Elections Director Julietta Henry, who has been doing an incredible job working tirelessly throughout this process to provide you with some additional information. Julietta?
Good afternoon. Again, my name is Julietta Henry, the Director of Elections for Milwaukee County, and it is my privilege. Today actually marks the 55th anniversary when the Voting Rights Act was signed, so it is truly an honor to be sitting at this seat at this time. So some of the precautions that people can expect when voting, there will be a health alert at all of your polling location, health alert signs. If you are experiencing any other COVID-19 symptoms, you can request curbside voting. There will be a number and a information listed at every polling location with that information for you. We are still encouraging you to take advantage of early voting, as George mentioned, and Claire as well. Early voting will still be in effect through Friday for municipalities, with the exception of the City of Milwaukee. You can vote up until Sunday the 9th. Go to our website for information with times included. There will, as far as the number of people who can go inside of a polling location, because the polling locations vary in sizes throughout the county, each polling location, it will be at the discretion of the poll workers at that particular location with the guidance from the municipal clerk. As Claire mentioned earlier, yes, some voting locations have changed. So as a result of COVID-19, so please contact your municipal clerk's office or go to myvote.wi.gov to find your polling location. There are still volunteers needed. You will need to contact your municipal clerk's office to see if they need volunteers on election day to work the polls. So as far as Milwaukee County residents requesting absentee ballot this year versus past years, we know on a statewide level, this is an unprecedented election. We had over 867,000 199 requests made as of today throughout the state of Wisconsin, of which 158,080 requests were made in the Milwaukee County. And as of today, 68,980 ballots were returned. We're requesting and encouraging you to return your ballots so your votes can be counted on Tuesday, August 11th. In addition, we do need, the question is, when do people need their mail-in ballots sent in? Right away. At this point, it's probably too late to mail it in. So what you should do is contact your municipal clerk's office for their hours. Most of the municipal clerks throughout the county have drop-off boxes in front of the clerks of the city halls or village halls. So please take your ballot, drop it off at your village hall at your convenience before Tuesday so your votes can be counted for this upcoming election. Thank you.
Thank you all. It's very important information as we head into Tuesday next week. We'll now move into the question and answer portion of our briefing with our media outlets online. And the first question is for Dr. Weston. It comes from Tyler Eddy with TMJ4. And he asks, are you seeing any increases of COVID-19 cases in school-aged kids? And have there been any hospitalizations?
Yeah, it's an important question, especially with the school year coming up. So we've certainly been seeing cases in the younger populations. We've seen quite a rise in cases in the 10 to 19-year-old age group, and quite a few cases in the 20 to 29-year-old age group as well. So the younger population is definitely being affected. We're certainly seeing hospitalizations in that age group as well. For confirmed cases of COVID-19 in the less than 18-year-old age group, we're seeing for every 100 cases, 1 to 2 of those individuals is getting hospitalized. So it's not an insignificant number, and it's something to be aware of as school season approaches.
Thank you, Dr. Weston. Our next question is for Claire, and is from Jeremy Janine. He asks, what are the totals for in-person early voting thus far?
So far, as of the end of yesterday, we had 3,269 voters at our in-person absentee locations. Our Midtown Center location remains the busiest. They've had over 1,700 voters, but over 3,000, which is definitely a record for August as well.
That's good news. Our next question, and what I'm seeing right now, it's our final question. So if you have any other questions for our speakers, please make sure to put them in the chat or let me know if you'd like to ask them yourself. But our last question as of now comes from Patrick Polantonio with WISN 12. And he's asking, ask one more question. Dr. Weston, can you elaborate? The governor says we're expanding testing in Wisconsin, but as the mayor mentioned, there's a shortage at Aurora. How is that possible?
Yeah, so the testing situation has been quite dynamic. We have different organizations using different labs, using different testing types. And really, it's an issue from a national level all the way down that there's such diversity in how the testing is working. So Aurora, for example, works with specific labs. They work with a specific test type. And it seems like in this moment right now, there's some shortages of that test type. I know they're working to serve the community as best as they can, but as I mentioned, right now we have lots of other testing sites all throughout the county and different options for people to pursue. The best way to find a testing site is to call 211. You enter your zip code, they'll get you connected up with a testing site.
Excellent. Our next question is from Sophia Carson with the Milwaukee Journal Sentinel. Mayor Barrett, I'm not sure, or perhaps Director Rausch, if you want to answer this. When does Milwaukee expect to have criteria ready to allow schools to reopen?
Well, the Milwaukee Public Schools has made its decision as to how it's going to operate, and the City of Milwaukee Health Department had a meeting this morning with a group of private schools to discuss really the standards and the criteria for their reopening. My understanding is that they're going to have another conversation about this either tomorrow morning or Saturday morning. I don't remember. I think it's probably tomorrow morning. And really, it focuses on a couple of issues right now. One is what happens if a student or a teacher tests positive. What is the protocol then for the rest of the school? And then they're still having a conversation as to what the general level of positive testing within the community or within the neighborhood needs to be. So those are the two, as I understand it, those are the two outstanding issues. And obviously I would prefer to get them resolved sooner rather than later. I think it's really critical for all schools to know what will be the criteria for closing a school, even temporarily. And I think the more certainty that can be achieved there, the better. I think one of the challenges here is that one would think in the United States of America that our Center for Disease Control or some other federal entity would have some guidance here, or that the state would have some guidance, neither of which have happened really in an effective way. And so it is left to the local health department to determine what the criteria should be if there is a positive test, again, for a student or for a teacher. I think that hodgepodge, to me, this should not be a political decision. This should be a scientific decision. But we're living in 2020 in America, and so it's become a local political decision. And I think that that's unfortunate. But that's what they're grappling with right now. Again, I'm hopeful that there can be a meeting of the minds. I think we have to remember that we're talking about the health of our children. We also have to have some certainty so people can understand how they can plan for the school year. So I'm hoping sooner rather than later.
Thank you, Mayor. And Director Roush, did you have anything to add? Oh, I think you're on mute still.
Yeah, thank you, Catherine. I was trying to pull this up while Dr. Weston was answering the question earlier about school-aged children and COVID cases. This report was released today by the Epidemiology Intelligence Team. And this specific report and this specific graphic you see on the screen here is related to COVID cases in Milwaukee County children who are aged 5 to 17 years. So this is our school-age population. And the trends are very similar to what we see in the general population. We're seeing the same spikes in July. We're seeing the same slight downward trend in the 7-day averages, but it does indicate and it does support the fact that there are significant cases amongst school children, and there's been a significant growth in cases amongst school children since the early part of July. And I'll share this report with Catherine to share out widely as well after the media briefing today.
Thank you. And did you have any other additional context to add as well as it relates to schools in the suburban municipalities?
Yeah, the school decisions in the suburban communities are being made, as they have meetings. I understand last evening, South Milwaukee's high school district, as well as the St. Francis School District, decided to go virtual to start the year. We know other decisions are coming up. Greenfield School District, for example, is looking to make their decision on August 10th, which is on Monday. Whitnall, another school district in the Greenfield area, is making their decision on the 17th. So I know many of the schools are having meetings coming up. Many of them have taken the advice and guidance from local public health, have seen the data as I've showed you on this media briefing, and are going to work with their school boards to make the best decision for their communities.
Thank you for both of those updates. The second portion of Sophia's question is perhaps for Mayor Barrett. Have any businesses been issued citations for not following the mask policy? We know of the 9 businesses that were warned.
I have not heard anything more from the health department today as to whether they've received citations. So I don't know the answer to that question. And obviously, once we get that information, we're happy to share it with everyone.
Thank you. And Patrick Polantonian with WISN 12 has another question for Julietta. He says, you mentioned curbside voting for those with symptoms. Is that just for early voting, or will it be available at all polling locations? And is it available for people who feel fine but are not comfortable going inside their polling place during the pandemic?
On election day, you can contact the municipal clerk's office. There should be a sign posted letting you know this is for health alert, letting you know the issues that are, if you have the following, you can contact them, but you can contact your municipal clerk's office and they will be able to provide you with curbside voting.
Thank you. And Patrick has another question. This one is for Claire. He's asking, how much has been spent on plexiglass, PPE, sanitizer, and other safety measures for Tuesday's election? And where is the money coming from?
So the bulk of our spending has admittedly been on the plexiglass, which won't just be used next Tuesday, but hopefully will remain in place for November. And then we're planning for next February and April as well. We have spent about $250,000 on that plexiglass, and then can repurpose it throughout the city in between elections as well. And the bulk of our help in paying for that has come from the state's CARES subgrant as well as the city's CARES grant. And then we were very fortunate to receive a $2 million grant for the Center for Tech and Civic Life that will assist us in making voting a safer experience this fall. So luckily we have had the resources we need to make in-person voting as safe as possible. And
if I could,
we've also received a lot of assistance from the state with PPE that the County Election Commission has also helped coordinate, as well as the Milwaukee Health Department.
and if I could put an exclamation point on this, at a time when local government is strapped enormously and we are facing huge, huge, huge fiscal challenges that we were looking at even before COVID hit, even before the economic tsunami, even before the racial unrest that we're seeing right now, we were looking at huge fiscal challenges. We have, and this is, I'm always looking for good news to report. This is good news to report. As a result of that $2 million grant, that civic grant, as well as the help from the state, this is an area where we have adequate resources. Again, 5 cities in the state of Wisconsin band together, applied for a grant. We received a grant, the 5 cities together, of over $6 million. The city of Milwaukee will receive over $2 million for that. So that is going to help us not only with the plexiglass, not only with the gloves, not only with other PPE. It will allow us to raise the per diem, if you will, or the daily amount that we're paying our election workers. We're going to raise it from $130 to $230. And I think that that is going to help us because we have had challenges with aging poll workers. And it's our hope that we can start skewing that to a younger age for health reasons and just to rotate the crops. We think it's important to bring in new people.
And Catherine, I would just add with respect to the state funding, it's my understanding that that funding was provided from the CARES Act. And I would encourage people to contact the Wisconsin Election Commission if they want to get more details on that.
Excellent. Thank you, George. Thank you, Mayor Barrett, for emphasizing that really good news. It's always important to hear that on these briefings and during this time. So with that, those are all the questions I'm seeing in the queue. So we will conclude our briefing for today. Thank you to our guests for joining us, and have a great weekend, everyone.
Thank you, Catherine.